Hello viewers, good afternoon again. Welcome to another edition of the coronavirus update in the Gambia. Of course, as you know, all these days, of course, we have been bringing you live update from the Minister of Health on the situation of the COVID-19 in the Gambia. And of course, today, Thursday, the 26th of March, 2020, the update is about to start, and of course our team is on the ground, and we will be of course bringing you live update on the situation of the disease in the Gambia. Yesterday you heard from the health minister, Dr. Ahmad Lamin Sidibe, who of course talked about on many issues with regards of the situation in the Gambia. There was no case confirmed yesterday. Of course, as there's been rumors, as you know, that there are some new cases in the Gambia, but that was never confirmed by the minister yesterday. And today we will be also going to hear from the health authorities and whether they would confirm of anything of sort. Of course, we will in a moment be going live at the Central Medical Stores in Kotu to hear from the health authorities, more so to the Response Emergency Committee, to tell Gambians through the media. Of course, iAfrica bringing you live update, and in about minutes or so, or less than that, in fact, we should be going live to the Central Medical Stores to bring you live updates, as the health authorities are already seated to give Gambians the latest update on the current situation of the coronavirus in the Gambia. And so this is the situation right now, and of course we would be going live, like I said. All right, Gambia so far have 3 confirmed cases. One already passed away on Sunday, as you may know. So 2 cases on the treatment, and of course we have 177 people on the quarantine, as we had from the minister yesterday. So we will now go live to the live broadcast and update of the coronavirus situation in the Gambia.
Good morning, ladies and gentlemen, members of the press. Good afternoon, ladies and gentlemen, members of the press, my colleagues in the coordination team, the director of communication, Ministry of Health. Ladies and gentlemen, we have a singular pleasure and honor to again engage you on today's situation report, which will be read by Mr. Mamadou Njai, who is deputizing for the Honorable Minister of Health. And as usual, he will be giving you information on global issues as far as the COVID-19 is concerned. He will also make a reflection of the regional issues as far as COVID-19 is concerned. Of course, subsequently move on to the national situation. In the report, we would expect to see reports on the issue of operation, which covers epidemiology, surveillance, case management, contact tracing, quarantine, risk management, safety and security, logistics, finance, and admin. So basically, these are the issues that the report would dwell on. Of course, to also give you the relevance of the calls received daily, and in which helps us to manage some of the cases that are to be reported. So without much ado, in some of those thematic areas I've just named, Mr. Njai would give you full details of the current happening as far as the Gambia is concerned. Mr. Njai, the floor is all yours.
Thank you.
You can skip it. Just skip it.
Because we told them to
In the question.
Can you please give us my
Okay, let's quickly do that. Quick work on your mic.
Sorry.
Yeah, go ahead. Alaji, Alaji, always conclusive day, is it? what was the end after the last review, the last data? Am I on your jump to all? Let's check the results.
Test results. What is the case currently on quantity and samples to be collected?
Yeah, but he was what is. And the same things in the previous one. The same. So today we expect to have a.
This bit. Because what we said here is, as of today 26, the samples will be collected for testing for the second time. For today 26.
Put it there.
And sample to
Collected.
All right, there you go. Of course, we are live there on the ground, but of course, you can see they are settling down some issues as we are about to hear from the, of course, Director of Health Promotions and Education, Mr. Modun Jai, who will be deputizing for the Minister of Health and update Gambians on the situation of the coronavirus in the country, both regional and national situation, as we just heard there. And of course, we will be hearing about confirmed cases, quarantine numbers. So we can now go back.
Are we set to go?
Sorry, can you minimize the noise? Sorry.
Good afternoon, colleagues from the media, Chairman of the Coordinating Committee of the Public Health Emergency Operations Center. I am reading the situational report for 25th of March 2020 and also taking you to the 26th of March 2020 press briefing. So all the information I'm giving you will be as of 25th of March 2020. And this is the 7th National Situational Report that is going to be read to you. And this is going to be done on behalf of the Honorable Minister, Honorable Hamidulamin Samate, who has asked me to read this report on his behalf. As I said, this is the 7th National Situation Report since the confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th of March 2020. I also want to give you a national situation. The laboratory results of the fourth sample sent to MRC are still pending because the sample was collected today, the 26th of March, for further testing and analysis. Compound of the third confirmed case put on quarantine, lockdown, since the evacuation of the patient from the village. Cumulatively, the country still has a total of 3 COVID-19 confirmed cases and 1 probable case at the moment. The probable case, second confirmed case, has started developing mild pneumonia-like symptoms. Regional situation. As of the 25th of March 2020, 43 African countries, including the Gambia, reported confirmed cases of COVID-19. Senegal, the Gambia's only immediate neighbor, reported 99 cases as of now. The first test of cases local transmission is of 25th March 2020 at 16:10 p.m., that's 4 p.m., a total of 454,939 cases of COVID-19 in accordance with the applied case definition over 96 countries, over 196 countries. Areas or territories of these, 20,547 deaths were registered, of 4.5%. Index case. Now to give you an information about the index case, the epidemiological description. A 28-year-old Gambian female arrived from London on the 15th March and self-reported for a laboratory MRC Gambia Laboratories on the 16th of March 2020. Manifestation of symptoms began on the 20th of March 2020, sample collected on 21st of March, and also results were positive, and the results received on the 23rd of March 2020. The probable case: a 47-year-old Bangladeshi national, male, travel companion of the deceased Bangladesh national, sample collected and to be tested on the 26th of March. This are recollected, the sample will be recollected again, but for further analysis, because the first sample that was collected, they still need to confirm it by doing another test, and that was also done. The probable case currently on quarantine at the moment, and I also want to give you the analysis of what we are currently having. And if you look at the number of, the summary of some public health response and outputs, now I want to give you the status where we are with regards to new cases and also cumulative. For quarantine, we didn't have any person that is new. All the cases we have now, total, we still have 177 people on quarantine. That's the cumulative. The people who have completed follow-up, completed quarantine, no one as of now completed that quarantine period, but we have a database which we are now tracking as to who should complete the quarantine period. That is also available. Completed follow-up, that's asymptomatic people with travel history to affected countries. There still remain 310, and then contact trace, additional 16 have been added as of yesterday, making a total of 73 people cumulative have been traced. Total tests conducted, as of now, cumulative we have 52, and then positive test results we still have 3, and then negative test results we have 47, inconclusive test results still pending 1. If you look at our major response activities as a ministry in collaboration with our partners, first I will start with components and various components and their interventions. I will start with coordination. There is daily press briefings ongoing, which is really a good practice. Daily coordination meetings are also ongoing. Statement issued by Supreme Islamic Council and Christian councils advising the public to abide by government directives on the suspension of congregational prayers. Surveillance. Plans underway to have samples collected from the high-risk contacts of URR confirmed case, and the team already are already prepared to set off. Regular monitoring of the condition of all people under quarantine, that's also ongoing. Training of contacts and contacts of contacts of the confirmed case is also still ongoing. Laboratory. 4 samples collected, but results from MRC are still pending. Logistics and security. Logistic risk assessment conducted at the sanatorium, EFSTH, ferry services, and the seaport. The Red Cross supporting the transportation of cases and the deployment of 100 security personnel to support response activities by JOG at quarantine facilities. Communication. Ongoing countrywide community sensitization. The U report pool ongoing to assess the level of understanding and to inform the public on COVID-19. Additional risk communication materials with messages on the training of public, on the banning of public gatherings have also been developed. Large volume of calls to the toll-free number 1025 hotline, and also I want to give you a summary of the calls received on the 10/25. Overall, 821 calls were received. As of 25th of March 2020, 228 calls received were related to community case surveillance reports, while 315 calls received were related to inquiry on symptoms and signs and prevention. The 278 calls not related to COVID-19 at all. We also have 118 calls referred to contact tracing team for follow-up. The next steps. The probable case to be transferred to treatment center, personal protective equipment to be provided to all health personnel conducting outreach services, health facility conducting routine immunization services to further sensitize mothers on the importance of social distancing. Expand COVID-19 testing facility to the National Public Health Laboratory, BL3 Laboratory, fumigation of the Public Health Emergency Operations Center, recruit additional personnel for the response, including contact tracing and rapid response teams. Looking at the outbreak case definition, which we also read some time ago, looking at this, who are the suspect, community case definition, probable case, and confirmed case, all those information have been related to you some time ago. And this is what I have for you. I thank you for your kind attention.
Thank you very much, Mr. Njai, for reading out the daily sit-rep, that is situation report, to the general public. I now have the pleasure to open the floor for a few questions and clarifications where necessary. We still continue to observe the same protocol, that is, you introduce your name and the media house that you represent, and you come up with your question. I saw a hand over there. You're welcome.
Was inconclusive, was anticipated. So we received confirmed report that actually the result the minister was referring to tested negative. Is this one of the reasons why if another sample is being collected from the same case?
The lab person is here.
Thank you very much.
Well, perhaps before he comes, he's the one heading with the lab, or working with the lab theme. Any sample collected has to pass through him to MRC. Anything coming from MRC has to pass through him. We felt it is more appropriate to let him respond to that question than Mr. Njai. You have the floor.
Okay. Thank you very much, Mr. Njai, and thank you very much, all of you. With regards to your question, in the lab, what we do, particularly, it is the Ministry of Health lab staff who collect all these patients, their samples. So once we collect the samples, we refer them, we send them to MRC, and then results come back to us, which is sent to EDC, and then translated to the highest office. In this particular case, in the testing, you have a platform that is the real-time PCR. So the reason why the patient is a probable case at the moment is because the screening tests have shown that it is positive, but the confirmatory test is saying it's negative. So that's why we are now putting in to get in another second sample to test and confirm. Yeah. So, sometimes it's during the incubation period or the viremia level is not high, you understand, you can have that type of result. But as he said, we collected a sample and then we are now waiting to do the confirmatory test and then see whether the confirmatory test will turn to be positive. But currently the patient have already been evacuated from the quarantine center to the treatment center. Yeah.
Said that health facilities will be strengthened so that probably more than one testing site will be established in the Gambia. How soon are you expecting
facility like the RBTH to be able to test for corona?
Basically, what he said is that the plan as a minister team is to ensure that we have testing facilities in all our health facilities. But priority will be given now for example, KOTU, which is a national public health laboratory, and also then it will also scale up. Then you have other facilities like regional laboratories can be set up, and they can also be able to do that. But currently, we are now building capacity. The team of the National Public Health Laboratory were able to develop a proposal to be sent to World Bank, and it will be received at both World Bank and then Global Fund. And then now plans are now for us to be able to operationalize this particular laboratory we have, so that we can do the tests, because the capacity is there with us. Our people are well trained, and they can do the sample. In fact, they are doing the sample collection. They do sample transportation, which is the most difficult part. Collect sample and transporting. And then they'll do the sample collection, they do the transportation, and they also take it to where it should be done, and that's where they do the analysis. We want to do all those things at this place, and we are giving ourselves, we don't want to commit ourselves, but I'm sure before the end of, before mid next month, you'll hear something different with regards to the Minister of Health when it comes to the testing of COVID-19 in the Gambia. We're also going to raise our hand and say, we have the facilities, we have the human resources, and we can do it, and it will happen. And that's our plan. And we discussed it even today, this morning.
Yeah,
I don't know
just to add on what he's saying, currently we have our lab staffs who are with the MRC team. We are collaborating with them, and it's not like they are training them. Some of them are there, and then they are part of the testing team to test for this coronavirus. So most of us will also be going there, at least to build the capacity there, so that at least they will not be overwhelmed with a lot of samples. But that is alongside the Ministry of Health is working, whatever it takes for us to have the capacity. You know, it's not easy to build up a lab to be able to do those testings. You need a lot of things. But this is an opportunity that I think we are seizing, to at least to make sure that, because we have all the trained personnel to be able to conduct it here. So that will come hopefully soon.
Chairman, if you may allow me, I just want to comment, because this question has been coming that we are slow with information. And as we say, we are improving on our press conference organization. We have a technician here who is actually an important link in the value chain. Just want to make it clear, and then the public should understand that as a government, we have to consider a lot of factors. And we all know presumption of innocence. We are already if I'm accused of theft, there must be evidence. I'm a suspect, I'm not proven guilty. So if the case is reported, as you can see, it is a suspected case. We are careful of our language. It's a human being has human dignity. We have to go through a process. It has to go through the gentleman here. He is a scientist. He may not be conversant with communication language. That's why I come here. So we have to wait for this gentleman. It might take 24 hours, 48 hours. And we have to wait as a government. When this result is confirmed, according to WHO standards, then we come to the public. And during that gap, of course, the social media, Bantaba, we understand. So I would like the public to understand that the government is not slow, not doing anything, but we are following procedures, laid standard operating procedures. The gentleman is here. Gambia has the human capacity, as he said. But we cannot rush this lab test just because public is hungry for information. We are improving. There's a lot of, during the coming days, more information will be there to help sensitize the public. We are here for you guys. Just bear with us that we are not complacent, but we want to do the right thing. We want to do the right thing, and that's why I just want to add up. And it is important that you've seen the gentleman. He's not a phantom. He's a real human being, a Gambian. They have the capacity, the human resources, and we are on the right track. We need your support. Thank you.
We understood that the community was locked down. To what extent is the lockdown? People are not still allowed to move in and out in Nigeria.
I give that to the director and the president.
I can respond?
Yeah, of course.
Okay. I was asked this question this morning on Gambia this morning. You must have heard. I got it very clear that I didn't have the information as to whether the whole community is locked down or the cabinet within the community or the compound within the community. But for your information, the information I got, it is only the compound that has been under lockdown. Only the compound. But social media, they say the whole village of Numuel is on lockdown. it is not the case. That's why it's important that we are given the right information here. It is only the compound. And why we are doing that, we want to limit the movement of those people within the compound because they already had contact with a particular case already. So that was the reason. It is not based on anything else. Not based on trying to suppress the village over, but just want to make these are public health measures. If somebody is sick and you want to find out who other else is sick, know who, where, and when, then you are able to go in for the immediate contacts. And that's what we did. But it's not the whole village, it's the compound that this case came from, and we definitely do have to do. This is in line with the public health regulations. Thank you very much.
Thank you very much, Mr. Njai. Yes,
it's important he made it clear to the
Mr. Chairman, just want to make another important thing clear. It has been spread in social media that in case of Numiel demand died, it's alive.
Exactly.
So, and that's very important. I would also like to
likewise, Birkama.
So the thing is that, that's why social media is the normal bantaba. You don't take anything you hear in the bantaba or in the market zone. It's normal. We respect the right of freedom of expression, but I'm appealing to the people to be responsible, and take care. Wait for official information. So the man in Numiel is not dead, he's alive.
Thank you. Thank you. Can we have him and then him?
Birkama, the unconfirmed report, but what is the ministry tell us? Because already the unconfirmed report is saying there was an individual who tested positive and all that. So we want to have clarification. And the second question is, what approach is the ministry taking? Because in a country like Sweden, if you have the symptoms, you have to call the health authorities to come over to the compound and then take you over. But in the case of Gambia, like in the case of the first individual that got the virus, he reported himself to MRC. So I don't know what approach, what is the advice from the ministry? Do you sit at home or do you just go to the hospital? Because we use commercial vehicles to go to hospitals.
Thank you very much. These are very important. I want to respond to the last one. When you are sick, you know the signs and symptoms are with you, just call 1025 and the team will come for you. Because if you travel, you are also trying, the risk of spreading the disease will be higher. Okay, you also talk about the case in Birkama. And in social media, they said the man was tested in Birkama. We want to make it very clear. There's no test of COVID-19 that is done in Birkama. That's one.
They don't have testing facilities?
They don't have any testing facility in Birkama. The test does not happen there. That's one. Even the health facility staff in Birkama are not even aware of any single case in Birkama with regards to COVID-19. So somebody just sat in his comfort zone, just sent a message just to cause unnecessary panic and alarm among the Gambia public. And this is very serious. Nothing has happened in Birkama. If there is a case or suspect or anybody else, we will get back to you. We will tell you. But since yesterday we have been monitoring, we have been talking to our staff, they have no information of such. So meaning, we want to tell the public that that information is false, it's not happening, and then let people not rely on social media platform. Some can come up with good information, but that information is wrong. We want to make it very clear. Anybody who does it, the purpose was just to cause, confusion, cause panic and alarm in the community of Birkama. So, and I also want to appeal to people. There was also somebody who have gone through the process and tested negative again, and the person now in the community, people are running away from the individual. We want to appeal to people. This guy has already been tested and is negative. Why do we need to run from the individual? We are trying to discriminate them. We are trying to isolate them. That is something that the public should be mindful of. Also, people also trying to even whether they get into a taxi, the moment you have an MRC badge or a uniform, health uniform, people start running away from you. This is something that people need to stop as of now, because there is no need for health workers to be stigmatized on this case. We want to appeal to the public. There's no need for it. There's no need for it. We just need to focus on our prevention. We've also realized that people are also still going on with their public gatherings. It's against, the policies of the Gambia government. We have to definitely apply. We have to make sure that we go by what has been stated. It's only, we said 3 weeks. Some countries are even going beyond 3 weeks. We are saying 3 weeks until we monitor the situation. So we want to appeal, we want the media also to use that opportunity to enlighten the public about it. That the suspension and public gathering, it must be implemented. People must implement it. From national level, it's been started, be implemented. Regional level, district, community, and household level, it must be implemented at all levels. So that's what I want to emphasize also.
Thank you very much, Mr. Njai. Can we have a question from you, then we get to her? Yeah,
regarding the same topic you're talking about here, when is this implications? When is this ministry going to take those steps? Because we know that all those issues are not actually effective right now. Public gatherings, the social distancing is actually not really effective. When exactly is your ministry going to take a step in that? Another question. Sorry. Okay, go on.
As I said, the can come up with suggestions and government come up with policies and guidelines and regulations. In these regulations, the ministry cannot enforce it. There are enforcement authorities, and they are all aware and they met. But before enforcement, I want to say, I want to challenge you, myself, and other people that the suspension statements are from government. It must be respected. It must be implemented by ourselves. We should not be forced to implement it, but we should take just the responsibility to implement it. So I want you to now to use your platform to tell people that let's not wait for the police to come and arrest us. Let's not wait for us to be taken to mile 2 or to where, because we are not respecting the laws of the land. We should, because it has been a statement that very day, in my opinion, the implementation should start. So I want to appeal to everybody that those public gathering suspension must be implemented. We have to go by it. The Supreme Islamic Council came out very clearly. The Christian Council also came out very clearly. I think we have to just go and implement it. That's what I want to appeal. Because the Minister of Health, we're not supposed to enforce. Our role is to make suggestions, come up with guidelines, technical guidelines. And then government use it now to make it as a policy. The policy must be enforced, and there's an enforcement authority, and they start meeting. But before we go into enforcement, let's try to change our behaviors. Let's try to change our behaviors. How can we change it? When there's an information for us to respect, let's respect it. And we are all there. We are protecting the public. Those laws are not there for enjoyment. Those laws are not there to block somebody, or those laws are not there to seize the rights of each and every one. But the laws are there to protect public health. And public health, we are protecting. You don't need to compromise with public health. Something that will make sure that the disease spread quickly and faster. If you see the way to block it, you have to block. And the only way to block it is to ensure that we suspend public gathering, because that is also, because public gatherings are going to encourage for us to be in contact together. That's why we are saying that. It doesn't mean that we want to say suspend it, no. We say if there is a public gathering, the tendency for people to be close will be higher, so that's why we are saying we suspend it for now, because that's the reason. Yeah. So people need to understand.
Thank you. Perhaps Mr. Sankano would want to add his voice to what Mr. Njai have just said. If you could just allow him a minute.
Okay, that's why I say, it's the responsibility of the government to respect your right to life. The right to health is your right, and that's why the government, the Public Health Emergency Act is there, is very clear. And as he talk about the sensitivity, the president's speech made it clear, gathering in all forms, that is comprehensive, but people are finding loopholes that XYZ is not mentioned, specifically. If you look at it, progress is being made. We have to measure the progress. Sensitization, the Christian Council, last Sunday, no church service. That is a progress. People were going to Ngente, naming ceremonies and wedding ceremony, but they started gradually moving it away. And we've seen that, at local level, the Carnival Municipal Council, they closed the market at 6 p.m. And the Supreme Islamic Council comes in and say that, we should suspend congregational prayer. It is suspension temporarily to respect your right to health and quality life and the right of your neighbors. And this is very important, and it's the responsibility of the government, and we have to consider the progress. Let's measure the progress that are being made. Within the context is very important, and that's why I would like let's continue the sensitization. The government wants everybody to involve. We don't want to be seen as dictatorial, but we want to appeal to your responsibility to respect what the president said in all forms. It has been gazetted. It's an executive or policy, government policy, which is being implemented. But we are giving the right to the citizen to first implement it by taking the responsibility. So we don't want to take the extreme measures for now.
Thank you. Can you come up with your second question?
It's my second question. Yes, Mr. Director, don't your ministry see it?
Very nice, but difficult to implement. Why I say it's difficult to implement, we need to look at the implications of a lockdown. If you lock down a city, what will happen? You are limiting the movement of people. You are working, you have something in your pocket every month. Somebody is not working, and the guy is depending on daily wages. For example, the mason, who is going out every day to work, to go and work and then get something on a daily basis, $150 or $200. And then you also have a market woman who wants to go and sell on a daily basis, to go and sell and get something for the family. The government is very considerate. The government is looking at all these points. There are a lot of discussions around what can we do. That is why if you are on payroll, there is an early payment today. This month people got their monies early, so that people can also get prepared to get something to buy food. That's one. Also that there will be a lot of consideration, because the government don't just want to come now today and say there will be a lockdown tomorrow. Now, gradually, the municipal council is also did something that I think you heard about that. Markets will be closed up at 6 p.m. so that people can there will be limited movement. These are the things that will have to go gradually and gradually. There may not be a need for a lockdown, depending on our circumstance at the point. There may also be a need depending on our circumstance. We are also monitoring the situation. If, for example, we know that there is a need for it, and that will warrant for us to go in for a lockdown, we will go in for it for a period. If there is no need, the government will not, there is no need for it. But as of now, if we are able to prevent ourselves, especially to address the issue of social distancing, and as well as also suspending public gatherings, we can also be able to do a lot. Now,
too late, Mr. Director?
I'm responding. It's not going to be late here, Chief. What I'm saying is public health is a step-by-step approach. You move from one step, you go to the next level. We are also guided by the international health regulation. The rights of the people must be considered. Their rights to food, their right to shelter, their right to all facilities must be considered and must be respected. We are also cognizant of that. We also recognize that. And that's why, in my opinion, for now, the lockdown, it will also be determined by the factors and also by the situation. As we move, we will see if there is a need, government will be advised by the ministry, and then also, in fact, it's not only Minister of Health. Other partners are outside, and we all work together. There's an interministerial committee. People are saying government did not do anything. Government set up an interministerial committee, and they have a meeting in the Minister of Health. Ministers were coming to meet with the minister. So something is happening. And most of the decisions are decided by those people. It's not only the Minister of Health. There's an interministerial committee that is meeting on a regular basis, trying to track out. So when there is a need for us to go in for lockdown, that particular committee will advise government, and I'm sure something will happen about it. And you'll hear it. When there's a lockdown, we just come here and say tomorrow is a lockdown, or next week is a lockdown. But that can all be done by us. The decision will come from the outcome of the meetings of the interministerial committee, advising government as to the next steps.
Thank you very much, Mr. Njai, for making it clear. I think you've been very good. We have to understand that one of the reasons why we coming out with this daily sit-rep is not only to let the public know or give information to the journalists, but this is also another platform that helps policymakers to know what decisions to take next. Because this is coming on a daily basis to give you the scenarios and situations on the ground. And this is what is going to compel the next decision of government. So I am sure as it is being released on a daily basis, as and when the time comes for a lockdown to be pronounced, they would for sure make a pronouncement. We also have to understand that the word lockdown is quite easy to say, but locking down also goes with responsibilities. Are we economically prepared to handle those responsibilities that is behind locking down? the countries we're trying to cite, they are making provisions of those people who are working, their wages, that is going to stop, and they need to survive. What responsibility is government going to take? You understand? I mean, these are all things that you need to put on the table, against your income to be able to take such a decision. So let's continue to pray that this particular setup of giving daily press briefing continues to give the relevant data that would help our superiors at the strategic level to take decisions that would be of good to all of us. So he had a second question.
I've answered that.
You've answered that. Okay. Can we have you, lady?
I answered that.
Yeah. Can you have you, lady?
I answered all your questions.
Can you have you, lady, please?
About that of the president and the cabinet.
Lady, can we have you?
Okay. Now let me answer that. You are saying that the president and the cabinet should do what test?
Example.
Okay. Let me tell you, for coronavirus, COVID-19, you cannot go and test because you want to do for the sake of testing. You must be able to possess the signs and symptoms similar to the WHO case definition for COVID-19. You must have to get those signs. You cannot just jump. Personally, if I can do it, I will do it, but I cannot because I don't possess any of the signs and symptoms similar to WHO case definition for COVID-19. Now I'm just giving you an example. I'm giving you an example. What I'm saying is very clear. You cannot, because one, it's not a requirement for countries like to say each country people must have to go through mandatory testing. It's not a requirement by WHO. It's not a requirement. But it's a requirement for an individual who possesses the signs and symptoms similar to WHO classification for COVID-19. That is exactly what we are doing. But there's no need. The president was, in fact, set the stage. You remember when he came from the airport. He was the first to come out at the foot of the aircraft to allow for his hand to be sanitized. With his cabinet, all of them, those who were on the flight. You saw it yourself.
But he was
willing.
He was never tested.
But there's no need for a test. There was no need for a test. There was no need for the president to be tested. For me, in my opinion, that was no need.
Okay, I think you've already responded to it. Yes, I know some of these things are coming as a result of seeing some few world leaders that are coming to the fore to have this test done. But we have to remember that what is good for the goose may not be necessarily good for the gander. What are the motives behind them testing? Exactly. Is something that one could question. Is it politically motivated? And so on and so forth. So I think when the need arrives for him to do so, nobody would call him to do. We would actually see him have it done. But it's a good question. We'll continue to produce the documentation. If he felt by virtue of information reaching him, he should now come forward, I am sure he would not be hesitant to come forward. But thank you very much. Can we have you, lady?
Yes, my name is Lutukota. I am from Italy. And my question is also a concern when it's burial. There was word, I heard word that the Bangladesh guy, how true it is, I don't know, was handed over to these people. How true it is, I don't know. That is why I want you to clarify how is burial done. We don't want to have a case of death, but in case we have, how will it be carried out?
Yeah, I think if you were very
observant or perhaps listening very well to the presentation, it has been clearly captured in today's sit-rep that the person has been given a dignified burial by the Gambia Red Cross burial team. We have a setup where the issue of burial, we have trained Gambia Red Cross staff that are trained on how to bury such casualties. And this was done yesterday, observing all the protocols, using the PPEs because they were at the front line. Their protection is our concern. It was never, I repeat, handed over to people, their own people. It was handled by us, our own burial team, buried yesterday at 5 o'clock at the Joshua Cemetery. And it's captured in the today's brief for your information. Thank you. Okay. In the absence of another, because we have some other assignment, this is daily. Even where you think you want to get in, move it to tomorrow so that you can allow some of us also. Because from here we are collecting information in readiness for tomorrow. So if you keep us here the whole day, tomorrow we may not have you again at 2:30. We may come here at 4 because we need to get the information, have it collated, have it validated before we call your attention. So at least you are given a chance. If you would not mind. No problem.
Immediately after the press conference, because we have local news at our radio, that is Taranga.
Exactly.
And I would include the English version there. So I would want if someone can speak in Wolof and Mandinka, that we can also use at the radio. So it would help a lot, because most of the people listening probably don't understand English, and this information is vital. So if we can have it in Mandinka and Wolof as well, then it would help.
Yeah, I will love that. I think from day one, perhaps it seems today is your first time.
Yeah, I had been, you asked them, your colleagues, I've been telling them that this needs to be domesticated to those other Gambians who are not privileged to be lettered. It's their right for them to know what this carry, and we'll be more than willing, perhaps in your own programming, you call to the communication director, he will get you the personnel who has the capacity to interpret this or to translate this into the local languages so that people really understand what this gathering is all about. Okay? We are more than willing to have that done. But perhaps Mr. Sankano would want to add his voice onto that.
This issue was discussed, and even today we discussed planning meeting. I'm going to disaggregate the message in all the local languages. As you can say, during the last briefing, we started with Sarahule. So we have the capacity, the team is already being prepared. So be rest assured that we will be doing that in local language, and we might go to GRTS, whereby we have a lineup of all people who will be able to relate this message in the local languages. So we are working on it and we are improving. One last thing is that, Chairman, if you permit me, the obsession with lockdown, state of emergency, they want to see state, full force with all the commando cavalry. Like I said, we want to follow the procedures and standard operating procedures because we are a democratic government. Before we reach the lead down, he mentioned an important thing. Let's focus on our solidarity, African solidarity, Gambian solidarity. You can afford 10 bags of rice. Your neighbor has to even struggle to even get a cup of rice. At this point in time, we should emphasize on solidarity, because we don't want a worst case scenario where there is a lockdown, a state of emergency. What about your neighbor? People are increasing prices. The government did its part by passing an instruction that prices should be frozen. So we have to still continue to emphasize community solidarity. That's what we should be working on at point in time, not thinking about lockdown. Because the situation is already tense, and many families are already in a very difficult situation. Ramadan is coming. So I'm appealing to our African value of caring and sharing, and this is what is important. That's going to help us move forward. I'd like to thank you, Mr. Chairman.
Thank you very much. This brought us to the tail end of today's press briefing. I appreciate the questions that are being asked. I only expect that perhaps in the subsequent ones, I would also want to see at least a journalist recognize the good moves that we have done. All questions cannot just be on the other side. At least appreciate what is.
All right, thank you very much, viewers. Again, that was the, of course, update from the Minister of Health on the situation of the coronavirus disease in the Gambia, done there by, of course, the Director of Health and Promotions at the Ministry of Health, Dr. Osnai, Mr. Modu Njai, of course, and interestingly, the situation virtually remains the same as of the yesterday, the report which we had from the Minister of himself. And of course, like I mentioned, as you've been watching, of course, we have been giving you live updates over the past couple of days and today as well. And of course, in a moment, we'll go back to the ground and talk to our man on the ground, Ibrahim Presba, so he can bring us wider discussion on some of the areas that were highlighted during the report of the situation by the director. You had them there, of course, clarifying so many issues, and of course confirmed cases still remain 3 in the country, and of course quarantine numbers also remain the same as of yesterday when the minister addresses the media. And so he also talked about the regional and of course the national situation at this moment, and you had all of that. And he also talked about the situation at the at the Upper, the Upper River region, where one of the cases were confirmed in Numuel, that is in Pasay. So he have clarified some of the issues, but of course, like I said, our man is on the ground. We will be going back to him again, shortly, so we can further discuss on some of the issues that were highlighted during the press briefing by the Health Ministry on the current situation of COVID-19 in the Gambia. And of course, like I said, somewhere somehow the situation remains the same. So I think that's just good of it. But of course, there are some other people that have been still under quarantine. Some cases tested, results are not yet confirmed, and all that. And but I would, of course, of course, I should say rather, we would in a moment digest all of that together with, of course, the man on the ground. He has been our eyes and ears on the ground, of course, keenly listening to the update there by the Director of Health Promotions, Mr. Modunjai. And of course, I think that was very good. But of course, I think also it's good to say he also gave the update on the continental side of things, and of course on the global side of things. 43 countries in Africa so far have confirmed the have confirmed cases in all the countries, and over 400,000 cases global. Now I think we can go live on the ground to talk to our man Ibrahim. Thank you very much for coming through again. You have been there for us. Now today, updates, like I said, not much changes as of what we had from the minister yesterday. Apparently it seems, Ibrahim, if you can hear me again, I would say, of course, looking at the situation, not much change as of the last report yesterday we had from the Honorable Minister.
Yes, Amadou, it is very clear now that the daily press update by the Ministry of Health and Social Welfare is more of confirming and rejecting information that will be already at public disposal. Not much is new from yesterday's update, like the minister informed us in Banjul on Wednesday that up to 177 people are so far undergoing quarantine. So today that figure didn't change, but what is added to the yesterday's press conference is also the refutal of rumor that a case was confirmed in Brikama in the West Coast region. So the ministry yesterday and today maintained that that was not founded information. And in addition to that, also the information that was making rounds on social media that the third case of coronavirus in the Gambia, which was confirmed in Numuel, that is in the Upper River region, has died, also is unfounded according to the ministry. So the press conference today is more of to verify public information rather than offering new cases to the media.
Very well. Now, another thing he spoke about is on the matter of the Bangladeshi man who passed away on Sunday. We understand that he has been buried. What more can you tell us about that?
The Bangladeshi national who tested positive happened to be the second case in the Gambia, and actually he died on Sunday. So since then he was in the hands of government authorities until yesterday evening, when the burial team of the Gambia Red Cross Society was allowed to conduct the burial. So this was a low-key ceremony for the late Bangladeshi. Even the host where he was, that is the Gambia Maracas, that is the Islamic center in Bandung, not many people were allowed to witness the burial ceremony. So this morning, iAfrica passed by the Maracas in Bundung to obtain some information as to the proceeding on the burial of the Bangladeshi man who was their stranger in the country. He was here on an Islamic mission. But the spokesperson from the Maracas said that at least about 15 people from the Marcas, including some scholars, were allowed to pray on the body at a distance. So you can see all the funeral or the burial arrangement was under the Gambia Red Cross. So no other person or ordinary individual was allowed to have direct contact with the corpse. So the pictures, we saw pictures which we were told not to release earlier on, but where you can attest to the fact that the arrangement or the handling of the late Bangladeshi was purely medical. You know, people who were directly in contact with the body to the Joswang cemetery were in full gears, and it was definitely a special situation which was as a result of the first death of a corona in the Gambia.
All right, and on the issue of the third confirmed case also, he have refuted reports or claims that the Numuel village or the community is on lockdown.
Numuel in the Upper River region, you know, before even the Ministry of Health confirmed that the case was true, information emerged from the local authorities there, that is from the Office of the Governor in collaboration with the regional health team in the URR and other partners, said that the community was on lockdown. But today, the ministry, through the Director of Health Promotion and Education, is saying that that information is not founded. So what obtains on the ground, according to the Health Directorate, is that the home in which the Gambian man in Numuel live is in lockdown to protect them and protect other people, and not the whole entire community, which also contradicts the information we got from the local authorities in the regions there.
Exactly, and of course another thing that was clear during the briefing was that of course he spoke about is the ministry for the preparedness to monitor or to test cases by itself, because they are the human resources is there, as he said. So can we talk on the new plans by the ministry?
Mm-hmm.
Yeah.
You can come again.
Yeah, exactly. I was just saying that, of course, it looks like the minister also have other plans to, to make sure they will expand the testing of cases and all that, especially at the regions. So, what more can you tell us about that?
Yeah, some breakage in the question, but I presume that you are asking about the contact tracing. So if so, the Directorate of Health said about 73 people have been traced so far. And this should be those in connection to the entire 3 cases that were confirmed in the country. We recall that the first case that was confirmed in the country was on a lady who returned to the Gambia from the United Kingdom. Actually, for this lady, her profile has been kept low. Her residence and her neighborhood is not been in the public affairs since the announcement of the confirmation of coronavirus on her. Apart from her also, yeah, of course, we knew that she came through the Air Morocco, so who where some of the passengers were in quarantine center and 17 jumped out. But after that also 73 people have been traced, but we're not sure as to whether it was only on those who came on via the air Morocco, the first lady to be confirmed positive in the Gambia. But we also know that the Bangladeshi who is late now came with some other people. So today the people at Marrakesh inform iAfrica that in fact, in addition to the number of people who were requested for quarantine, exercise or medical, situation, more other people who felt they had contact with the Bangladeshi voluntarily came over. They came over and the Ministry of Health, found them very complying to the rules of quarantine. So away from that also, the Gambian man who traveled from France, and that is the third case, came to the Gambia on an airline which brought along 59 other people. So out of all these possible contacts, 70 have been traced successfully according to the Directorate of Health Promotion and Education.
Very well. It's good that you have clarified that, the issue of number of contact cases and all that. But I was just asking now, if you can hear me very well, that of course it looks like the ministries also have some new plans to further do their own testing and all that. Yes, I think Ibrahim is somehow not hearing what I'm asking at this moment. But yeah, if you can hear me, I will repeat it again. I said it's good that you have clarified some of the other issues, but I was saying the ministry seems to be also working on plans to further expand their testing programs across the country. All right, I'm afraid we would of course have to, end it there with Ibrahim because of sometimes how technology is. But thank you for the update, and of course, viewers, as you have been watching live on Africa TV, we heard from the health authorities or the Ministry of Health today that, of course, seemingly the situation remains the same. No new confirmed case as of yesterday, the 25th of March 2020, and today's update was very much focused on that, despite the rumor, despite the speculation around the social media. And of course the director was very much clear on that, said Gambians need to wait the confirmed and accurate information, and that's why we would always want to endeavor to make sure we give you accurate and reliable information from the authorities themselves. And of course the situation remains as this: 3 confirmed cases still for Gambia, 1 probable case not yet confirmed though, as we heard from the director, Mr. Jai, today. Quarantine numbers still remain 177, and of course yeah, and among other issues also he talked about is the number of tested cases, 52, negative cases 47, and of course he globally, or of course nationally, give us the national situation of the coronavirus, and of course the situation at the Upper River region, and plans that the ministry have to continue on their work to monitor and of course inform Gambians accordingly on the situation of the coronavirus in the country. On that note, we want to thank you so much for the pleasure of your company as always, and also, as I always say, relying fully on Africa TV to give you updates as it happens from the Ministry of Health on the situation of COVID-19 in the Gambia. Till we meet again in another time. Thanks for now.